All right, today I'm going to be doing my newborn assessment. I have my newborn here, and I'm going to go ahead and get started. So first, before I even go in the room, I'm going to do hand hygiene, put on some gloves, walk in, and I have my newborn here, so I'm going to just unwrap one of their legs so I can look at their patient identifier bracelet, make sure that I have the right patient, and I'm going to check it twice, once in the computer, and if mom or dad is present, I'm going to confirm it with them. Mom and dad is not currently in the room with me for this scenario, but I did check in the computer, make sure there also is no allergies or any kind of other alerts I need to be aware of. I'm going to explain the procedure to mom and dad if they were here, explain to them I'm going to do a general assessment, check the baby's vitals. I'm going to be looking at their skin, looking at their head, assessing their fontanelles, looking at their stomach, their back, assessing their reflexes, and then assessing their reproductive area and make sure everything is looking okay and there's no abnormalities after the birthing period. And then I'm also going to be assessing bonding, mood, and any cultural considerations with the mom, assessing if she's holding the child, if they're concerned with the child, if they want to come up and be a part of the procedure. All of that I would kind of take into consideration and observe. But again, for the scenario, I chose to not have the parents in the room, or at least not here. Next, I'm going to ensure that the environment is safe for my newborn. So this newborn is in a crib. I have one of the side rails down, but the other three are still up. There is nothing in the crib that the newborn could be unsafe towards or use unsafely or anything like that. The warmer is at the back here. So we're going to go ahead and get started. So I'm going to unswaddle my newborn and I'm going to start with my general assessment. So I'm going to be doing some vital signs to start. So first I'm going to start with the heart rate, which I'm going to listen at the apical pulse in the middle of the chest here, and listening for a full minute. A normal apical pulse should be around 110 to 160, and I would also be listening for any swooshing sounds, which could be indicative of a heart murmur. It sounds regular and heart rate within normal ranges. Next, I would assess the tummy or look at the abdomen to assess the baby's breathing, their stomach breathers. So I would again watch their stomach for a full minute. If I want, I could also put a hand on the stomach to kind of confirm what I'm watching, to confirm and count their breathing, again listening or watching for a full minute. Normal respirations should be 30 to 60. I would also assess the breath sounds, making sure it's equal and symmetrical bilaterally. He's not breathing, you can't notice breathing on one side, would be indicative of something abnormal. But also make sure that there's no nasal flaring or retractions and that the work of breathing looks normal for the baby and not in any distress or increased work. So it looks good to me, breathing okay, no nasal flaring, no retractions, respirations are within normal ranges. Next, I'm going to assess the tone of the baby, so their muscles, making sure they're not like rigid or flaccid. He's not just laying flat. They have some bend and pliability to them, and they're kind of moving around as needed. They're not just statues and stuck rigid or anything of that sort. Then I'm going to assess the activity. Baby is sleeping right now, but I would want to make sure they're not jittery, anxious, super aggravated, or anything like that. They should be comfortable, and I'd be assessing that. Next, I'm going to check their skin, so making sure the color is appropriate for the ethnicity. It looks good for teddy bear here. I also want to check if there's any lanugo hair on the body, which can be normal if it's a premature birth. This baby is at term, so I don't notice any crazy lanugo. They do have, he does have like normal hair on his body like everyone, or every baby, every normal baby, like eyebrows and such is what I'm going for. But I would also notice of any birthmarks. I don't notice any, and any jaundicing or yellowing of the skin or the eyeballs or anything in the orbital area, any yellowing, any mottling on the skin, or any signs of a rash. I don't see any for baby teddy bear here, so I'm going to move on to the head and neck. So next I'm going to look at the head shape. So using my hand, I'm going to put it under his chin here and kind of lift him up so I can assess the head. And for this, I'm going to be looking at the fontanelles as well, which is why it's easier when they're sitting up. So holding baby here at the back, supporting his head. I don't see any like modeling or like weird indentions or bruising or any kind of weird shapes of the head, although that can be normal. I don't see any kaput or abnormal swelling, which can happen, or any hematoma signs, abnormal bruising or like breaks, or I can't remember the other word right now, but no abnormal bruising on the head, so that is good. To assess the anterior fontanelle, I'm going to go back in between the frontal and orbital lobes, I believe, and just press down. It should be a little bit kind of like an indentation, soft, not bulging, which could indicate increased cerebral pressure, so that's good. And then I'm going to go back to the posterior fontanelle, again, same thing. Feels good to me. Should have an anterior and posterior fontanelles, and as a newborn they should be present. If they're sunken in, could mean dehydration, and again, if they're abnormally swollen or bulging, that could mean that there is an abnormality in the structure of the skull, so we would make note of that. But they look good. They're soft, not super flat and not super bulging. Next, I'm going to lay Teddy back down so that he is relaxed. I'm going to take a look at the eyes, make sure that they're symmetric, there's no discharge, opening to like stimulus cues. Looks good. Next, I'm going to assess the ears and make sure that they're also symmetric, and I'm going to be looking for their placement, like how high up they are on the head, make sure they look even on both sides, and I'm going to look for any tags on the ears, anything of that sort. Next, I would check the nose, make sure that there's airway patency, so you can check if they're breathing okay is the main point of looking at their nostrils. Looks good. I don't see any crazy drainage coming out of the nose. Looks symmetrically flaring, not overly flaring, but nasal flaring, normal for newborn. Next, I'm going to look at the mouth, and I'm going to take my gloved pinky and I'm going to put it at the roof of his mouth to check the hard palate and the soft palate, making sure they're okay. And then I'm going to go around the edges for the pearls. I can't remember the first name of that specific term, but look for the pearls, which would become the teeth. Make sure that everything feels normal, looks good. I'm also going to check the lips, make sure there's no cracks, indentions, or any like cleft lip palate, any abnormalities of that sort. Looks symmetric, pink, no breakage, not dry, no drainage from the lips anywhere. They also move symmetrically, which you can just look by observing and see. And then last, I'm going to check the range of motion of the neck and making sure the clavicles are intact, because with shoulder dystocia or things like that, when the babies are born, their clavicles can be broken, and so we'd want to assess for that in our assessment. So I'm going to take the neck and gently turn from side to side. This also is one of the reflexes, which we will get to in a little bit, but looks good. Baby can bend forward, bend back. And then I'm going to just slightly palpate around the clavicles, make sure there's no crepitus, anything like that. Arms can move symmetrically up and down. Looks good. Okay, next we're going to move to the chest and like cardiovascular area. Make sure, again, I don't see any crazy bruising or anything. We already assessed the heart and the lungs. Good there. Then I'm going to check their capillary refill along with our cardiovascular status. Should be less than 2 to 3 seconds. All 10 fingers and all 10 toes bilaterally, symmetrically. Looks good. And this would also be assessing for like core and circummoral perfusions, making sure there's no cyanosis. A little acrocyanosis can be normal, but no cyanosis like on their lips, or things like that close to their heart. So perfusing well, skin looks normal for baby, and their heart seems to be sounding normal and regular. Next, I'm going to check their abdomen, so I'm going to auscultate the bowel sounds. So I'm going to look at their tummy, make sure it's not overly distended, it's not flat. Their head is normally larger than the rest of their body, but their tummy is a little protruding as a baby. And so next, after inspecting this tummy, I'm going to auscultate starting at the right lower quadrant. Should be normoactive in all 4 quadrants, and then I'm going to palpate. Feel soft, non-tender, non-distended. I'm going to check the umbilical cord site. It is probably going to be clamped because it's going to be falling off in a few days on its own. And I want to assess the cord. There should be 3 vessels, 2 arteries, and 1 vein. When assessing for those 3 outputs, I also want to assess if there's any foul smelling discharge, any redness, any kind of streaking, anything of that sort. All looks good. It should be pretty dry. It'll dry up on its own. Looks good. I want to make sure it's open to air to let that drying process complete. So no signs of infection, and we have it open to air and it is clamped. Next, I want to adjust the voiding status. So you would have a diaper on, so I'm just going to take that off, see if there's any voiding, and if anything, I would ask the parents, have you been keeping track of the diapers, because we'll weigh them. But for now, looks good. There is scant urine output on the diaper, so voiding status seems to be good. I'm also going to be setting my scenario as a female newborn patient. So when assessing the GU system of a female newborn, what you want to look for is the labia majoris. After birth, they tend to be normally a little swollen. That is normal. I would explain that to the parents. I'd also tell them that any milky reddish discharge for about 3 to 4 days due to the maternal hormones is normal to see coming out. You can observe that in the diaper. I'd also want to assess if there's any vaginal tags. That's normal, but those will disappear over time. That is the beginning of the cervical ring, I think is what it is. But again, that is normal, but it will go away. Looks good there. And while we're here, just making sure, again, the skin on the legs looks good. And then I'm going to move on to my musculoskeletal assessment. So I'm going to, again, lift the baby up and check his spine, keep him holding here, make sure it looks straight, there's no sacral dimples and no, I'm just going to turn around for the sake of the video, but I would not do this in real life. No sacral dimples and no tufts of hair, although this tail, anyways, don't count that. It's not a tuft of hair, not a sacral dimple. Those would be causes for concern to notify my doctor. I'm going to also check the extremities, make sure they look symmetric on both sides. I also would want to assess the movement in all of the digits. We can do that simultaneously when we're checking the capillary refills, make sure that they can move all of their extremities. They'll probably be a little turning and anxious when we're doing the assessment, so I'll observe that. And then I'm also going to assess for the reflexes. The first one is the Moro reflex. So this should be just that normal startle to noise or sudden movement. What the child should do, if it's normal, is throw their head back and then lift their legs and arms to that startle. That is a normal response, so baby's good there. Next is the rooting reflex. So gently stroking the cheek, they should turn their head and then open their mouth. That is the normal response. The sucking reflex, again, we could do this when you're checking the palates, but you take your gloved finger, place it in their mouth, and then they should begin to kind of suck on it as if on a nipple or milk bottle, and you want to assess the strength of that sucking. For the palmar and plantar grasp reflexes, you would take a finger and place it under their palm or under their feet, and they should either curl their toes down or curl their fingers around yours. So you do that on both sides, bilaterally, symmetrically, and then assess the strength of the grasps. You should be able to, if you did it on both hands, be able to hold them up for a few seconds at their pull them up from their trunk a few seconds. And then next we're going to check the Babinski reflex. So I would take maybe my finger, you go from the heel upward, stroking from the heel to their sole of their foot. The big toe should point up and the other toe should fan out. That is a normal response to the Babinski reflex. It should not go away. Let me come back to that. And then I'm going to check the tonic neck reflex with newborn laying supine. what we would do is gently turn their head to the side, and what you want to look for is they extend this arm and this leg, and then they flex the other side. And then again, turning the head to the other side, flex and flex on the same side of the face. Extend their extremities on the same side of the face, and then flex the ones opposite of that. And then lastly, I'm going to check the trunk incurvation. So with this, you would hold the baby ventrally, so on their stomach. And what you're gonna do is you're gonna go from the bottom up on one side of the spine, and what they should do is turn and swing their pelvis toward that side. That is a normal reflex response. So that is the newborn assessment. And once I was done, I would swaddle the baby back up. And if mom or dad was present, I would hand them back to mom or dad. Thank you.